Good evening, and welcome to the week 2 walkthrough. I am my own audience tonight, which is fine. Hopefully you all will watch the recording at your convenience. What I wanted to do was start out with reviewing week 1, and then we will move forward into week 2. So let me go into the modules just to recap and make sure that um, everybody is clear on what needed to happen for week 1, and moving forward, then we'll go into week 2. So let me put on view as student. There we go. And let us go to week 1. So week 1 was our getting to know you week and our introduction to health and social justice. And there was also a lesson about understanding and using credible resources. This was for you. There was an activity, but you're not required to do it. However, since we will be looking at different public health issues and other things in the course, I would suggest that you take a look to be able to understand what is considered a credible source versus not a credible source. I also posted accomplishments for week 1. So I do try each week to recap what y'all have done the previous week. So tried Google Chat. Many of you tried that for the first time. Kind of did a fun way of reviewing the syllabus. Most feedback was pretty good about that. You met each other in a discussion, video discussion, got to see all your lovely faces. And then you also had a free writing assignment about health disparities, health equity, and social determinants of health. Make sure when you're doing these that you follow the rubric so you know what the expectation is. I did leave feedback for some students about specific things that I'm looking for in your writing or in your Padlet, which is the next thing that we'll talk about. But I just wanted to make sure that you knew where to find that, you know where to find the rubric, and that you are in fact looking at the rubric. To earn the complete points for that assignment, you needed to address health disparities, health equity, and social determinants of health in detail with examples of experiences that you have seen. And then y'all tried Padlet, which was pretty cool. I think it's a pretty cool thing. Let me show you what that looks like for those of you that have yet to do that. This is what the Padlet looks like. And so basically you just add your, you click this plus button here and it pops up a little box. And what I have done is color coded, so I know when students have added a new Padlet. So for example, Jewel and Veronica. So I'm leaving those in white. And then as I go down, Natalie also provided her post. And as I've gone through, if I have graded, if you have done your post and you have also commented to another student, then I have put you in this lilac color, and there should be a grade in the grade book for you. If there is a different color, then you probably have not commented, or I did not see a comment yet to another student. And so as soon as you do that, and I do check daily several times, and probably left a comment in the assignment as well, then I will go back and regrade that for you. But I will say your stories are amazing. I cannot tell you enough. Thank you for sharing the things that you've seen and experienced. It's just incredible. I don't even know what else to say. It's just amazing. Thank you. I really appreciate your going into depth and sharing about that. I really appreciate it. And the hope in this course then is to, having been able to identify the disparities and the inequities, and understanding how they connect to social determinants of health, which we're going to study about again this week, and also add in now structural determinants of health. Next week, we'll talk about data gathering and statistics a little bit. that will help us to be able to plan interventions or educational options, things that we can do to help advocate. Many of you talked about advocating, which is definitely something that we want to do to help people. So I'm really excited about moving forward with that for the rest of the course. You also created your social justice journal. And so we'll talk about that as we get into week 2 as well. And so those were your accomplishments. All right. So let me just double check, right? The journal, the Padlet, the free write, and you did all of those. So that is good. So let us leave student view now and let's move on to week 2. So when we go to our homepage or the landing page, you will now see the announcements that are there. And if anybody's asked a question or replied, I see that pop up so that I can answer back, answer the question. And welcome to week 2. So now we are into week 2, looking at governmental influences and social and structural determinants of health. You have the link to the week right there, which will just take you back to that module, the week 2 module. We're going to look more in depth at the social determinants of health, the way that the social and structural determinants are interconnected over a person's lifetime, and also looking at ways that we can start to think about problem solving. We're also going to look in terms of our own local communities and identify problems, barriers to health access, things that we might see, and figure out ways that we can, like so many of you would like to do, and have made it very clear that you would like to advocate and help and make a difference. So the course objectives that we are covering that relate to week 2 are describe strategies to improve health disparities through advocacy, community organizing, and/or policy change, as well as demonstrating advocacy skills such as preparing a policy brief, community outreach, writing a letter to a politician, or giving public testimony. And we are going to do this in a way that reinforces key points and objectives from week 1, which are examining disparities in health outcomes, comparing and contrasting individual behavior and public health models, and researching current public health issues using credible information sources. We will, many of these overlap, and we'll keep coming back to some of them and move forward and come back and move forward till we get to where we want to be. The actual objectives for this week's lesson for week 2, we're going to talk about explain how education influences long-term health outcomes, analyze relationships between income, wealth disparities, and life expectancy, assess structural inequities related to race and gender, apply critical analysis to identify local structural barriers using a case study, and reflect on visibility and impact of social determinants in personal community context. So looking at our own communities. And then if we look again at the student learning outcomes, being able to identify our barriers to accessing healthcare and developing strategies to combat health inequities and promote advocacy. So we are right on target. The key concepts for this week will be social and structural determinants of health, education and health, income and wealth gaps, and race and gender. So as you recall, there is not one textbook per se for the course. I will give you the readings on this lesson page. That will be what is required. So here are the links. Some of these are infographics. Some of these are chapters, like 9 and 10 here are chapters. I also added, the Mackenzie and the Schneider textbooks, which you can actually download and keep for yourself and reference if you need to. And these are the chapters, and these are the specific pages in the chapters to focus on. And then I also added the disease prevention theories, health promotion, disease prevention theories and models. We'll talk a little bit about that. And so that was that website. that you had available to you. We will go into more detail. So the assignments this week, the things to work on this week, there is a discussion, how structural factors shape health outcomes. We'll take a look at that. There is a case study analysis related to a local structural barrier. We're going to take a case study and look at the structural barrier that barriers that are presented in the case study, and then make a connection between them or not, make a connection with similar things, compare and contrast in our own, in your own local community. And then there is also a reflection on objectives using videos. There is a video series that is available called Unnatural Causes that speaks to a lot of the inequities that you have mentioned so far in the course. And so you can choose one of the 7 videos and write a reflection on how it relates to what you've learned so far in the course. And then you also have your journal for week 2. The journal for week 1 is due on Wednesday. So make sure, please, to share the link with me, make sure that I can access it. What you need to turn in for that assignment is just to either when you go to submit the assignment, one of your options is a website URL, and you can put in the Google Doc there, or you can also copy and paste the URL into the comment section so that I have access to it. Once I see the link go up, then that signals me that, oh, okay, I'm ready to have it graded, Mrs. Hollander. So that's something to do. I did add, I had said in the beginning that if there were some questions that I wanted to add to your journal, that I would do that. And so you see here in pink, I usually add any changes in pink just so that it stands out. So these are the additional questions to add to your social justice journal. You have the original, so you're going to have to copy and paste these into the journal. So let us look at the assignments, and then we can go back and look at the lessons that that are available in the module. Actually, let's go look at that first. So if we go to the module, the week 2 module, this link takes you right to the week 2 module. There we go. Let me go back into student view for you. There we go. So week 1 we covered. Moving on to week 2. So the overview that we just looked at. And so you have several lessons here. You have a lesson on Healthy People 2030 and social determinants of health. How Healthy People 2030 addresses the social determinants of health. And then you have a lesson on the public health models and community organizing, because we're going to have to take what we're learning in this lesson and expand on it as you work on your project for the end of the semester, which we will review briefly. What I will do is put a short video together of what to put together, how I would like it put together, and then you'll know, then you can ask questions after you watch the video. And then there's also a lesson on the structural determinants of health. So there's lesson 2.1, 2.2, and 2.3, and then this is part of 2.1. There are also supplemental articles to read. So this is above and beyond what is listed in the overview. These have to do with governmental influences, which count as structural influences on healthcare. And this talks about the Affordable Care Act, problems with accessing care, things about Medicaid, also known as Medi-Cal in California, how Medicaid is funded, some things about Medicare in there as well. So those are for your reading as well. And then the assignments that are due. So let us go back and look at, I'll walk you through the lesson, and then we will look at the assignments. So looking at the Healthy People 2030 and social determinants of health, we did talk about social determinants of health kind of briefly, kind of introduction to it last week. And so this actually is a lesson partly that's taken from Introduction to Public Health, which I also teach. And so talking about the different roles that social determinants and Healthy People 2030 have in terms of people's health. And these align with the week 2 objectives, these lesson objectives, in terms of analyzing the relationship between income and wealth disparities and life expectancy, and reflecting on visibility and impact of social determinants in personal and community contexts. So this is Healthy People 2030. Let's go to the website because I think it's kind of interesting. Let me just show you also, there are a couple videos here. There are also some links here that talk about social determinants of health, educational access, healthcare access, neighborhood and built environment, social and community context, and economic stability. In your Padlet from last week, you were to share an inequity that you, or barrier to health that you had seen or experienced, and then tie it to a social determinant of health. Some students kind of forgot that little part, so you got a comment from me asking, if you had to choose, which one would you choose? And so now we're going to go a little bit more in depth. And so you have the links here that you can look at. And if you look at this figure here, it shows you social determinants of health. They do also include food in there, which can be generally either under social context or neighborhood and physical environment, but shows you different examples of that in terms of like neighborhood. What's the housing like? What is the transportation? Is it safe? Are there parks and playgrounds? Where is it geographically? Healthcare system, what kind of health coverage is there in your community? What is the provider availability? How many of us, and some of you even shared how long wait times were to see a provider or to get into the emergency room. And I think almost everybody talked about quality of care or lack of quality of care. So those are social determinants of health. And then there's another video that talks about that. And then there's also a brief overview lesson of a what's called a windshield community assessment. That's not something in this course that that we're going to be doing, but just so you, looks like it's taking a while to load. So I think what I will do is we'll close that out and I'll just tell you about it instead of show you. So when you do a windshield survey, generally you choose a zip code that you're interested in, or perhaps that you actually live in, and you are looking at your neighborhood, that community, if you will, in terms of social determinants of health. And once you do that, that helps you to find where gaps are, and then you can put a plan together to figure out how to prioritize and implement some kind of program, project, education to help people in the community. And actually, that's what Healthy People 2030 does. So if we go to, let's try 2030 and social determinants of health. So this link actually takes you to the Healthy People 2030 site. Talks about the social determinants of health. And if we choose, let's see, let's do healthcare access and quality, since that's what we mostly were talking about this past week. So let's put that in a little bit of context. So when we look at this particular social determinant of health, healthcare access and quality, the Department of Health and Human Services has created a goal for this particular social determinant. And the goal is to increase access to comprehensive, high quality healthcare services. So access, being able to get to a doctor, and high quality healthcare services, receiving those healthcare services, regardless of, as many of you pointed out, income. That was a big deterrent to receiving high quality healthcare services, as well as the personalities of some of the healthcare providers. So then when you scroll down the page, it will actually tell you about specific objectives, often across the lifespan or associated with different medical diseases, and goals that have been set. So these are sort of targets that we want the United States to reach. We want our citizens to be healthy. So we have set these goals. And so as you scroll down, it will tell you about what the social determinant is, what it means. And then you'll see that there are different objective, what they call status. So as we scroll down to get to this list of related objectives, we can look at those. There's 5 that have been met or exceeded, 8 are improving. So those are good things. 5 have gotten worse, which is not good. And 12 have little or no detectable change, which is also not good. We would like to see it at least improving somewhat. And there are also some that are included as developmental or that are in a research type process. So let's look at these related objectives that are connected to healthcare access and quality. So they have a general category, reducing proportion of emergency department visits with longer wait time than recommended, and increased proportion of adults who get recommended evidence-based preventive healthcare services. So that might be a mammogram, for example. And those have little or no change or are getting worse. Then the related objectives will move past specifically healthcare access and quality, but then break down into either a developmental stage or a particular medical diagnosis. So, for example, adolescents. Increase the proportion of adolescents who speak privately with a provider at a preventive medical visit. Increase the proportion of adolescents who had a preventive healthcare visit in the last year. So how do we get teenagers to those preventive healthcare visits? How do we help them to feel comfortable talking to a provider, speaking privately to a provider, perhaps about alcohol, drug use, sexuality, things like that, because those are not going in the right direction. There's also objectives related to cancer. So proportion of females who get screened for breast cancer, which is improving. So that's good news. Increased proportion of females who get screened for cervical cancer, adults who get screened for lung cancer. And then you move down to children. So children with developmental delays who get intervention services by age 4 years. That's sort of in a research holding pattern there. Also community, these are ones that they're developing. Increase the number of community organizations that provide preventive services, right? It's one thing to be able to get there, but if there's not a lot of them around, then it's more difficult to do. Increased proportion of people with a substance use disorder who got treatment in the past year. There's family planning, healthcare, increased use of oral healthcare system, reduced proportion of people who can't get prescription medicines when they need them. Now that one's been met or exceeded, so that's a good thing. There are also some, you'll see this little LHI sticker here, leading health indicator. So of these particular objectives that we're looking at, there are what they call leading health indicators, which are sort of the next level up. There are less of them, they're more overarching, and it's good that that is met or exceeded, because once we meet them, then hopefully we can move them to, let's just keep it in where it is or better column, and start to bring some of these other ones that have not been improving and focus more on them as well. Personally, I think there's too many objectives, but they are, most of them are pretty darn good. Reduce proportion of people who can't get medical care when they need it. So that's improving. That's good. Health communication, health information technology. A lot of those are still in development and research phases. Health insurance, many of you mentioned in your Padlet about lack of or different health insurance. The provider or whatever didn't take the insurance that that your relative or you had. Oral conditions, pregnancy and childbirth, sensory communication. So just all these different objectives that fall under the social determinant of healthcare access and quality. And I think you can see, especially based on what you've shared already this last week, where this is going. So let us choose one that I can show you more in depth. Let's do, oops, that's not the one I wanted. Here we go. Increase the proportion of females who get screened for breast cancer. So this one is improving. Let's look at one that's improving, and then we'll look at one that's not improving. So if you click on that particular objective, it will take you to a page that will give you data and statistics about this particular one. And so this one is increased proportion number of females who get screened for breast cancer. And so status is improving. The baseline where we started, this is for the country, was at a 76.2%. Ages 50 to 74 received the breast cancer screening, and they're looking at the year of 2019. So that was the baseline. So understand that Healthy People, the project has been going on since at least 2000, might even be 1990. I can't remember off the top of my head, but every 10 years. So we had Healthy People 2020, 2010, 2000. So every 10 years, it gets reorganized and looked at. If we've met certain ones, they get moved over. We bring other ones up. And so, for example, this one in 2019 was 76.2%. Our most recent data that is here is 2023. So that's pretty recent. And we are at 79.8%. So we are better than where we started, right, in that short time. Now, the goal is 80.3%. So we would like an increase. That is what is desired, because we're so close. We're at 79.8, and we'd like to get to 80.3. So that's what it means when it says improving. And so basically what you can do is you can go through the website and see more detailed information. You can see where they got the data, how they measured the data. They'll provide a summary for you and maybe other objectives that might interest you. They also have a tab about data that tells you, again, those kind of statistics, where they got the data and the methodology, how it was measured. And then they have an evidence-based resources section, which will give you specific evidence-based resources, credible resources that are related to that particular objective regarding breast cancer screening. So let's go back to the objectives, and we were looking at social determinants of health, and we were looking at healthcare access and quality. And we want to go back and look at something that is getting worse. So let's do, how about increased proportion of adolescents who had a preventive healthcare visit in the past year, which is getting worse. So we go here, and it shows us where we stand. So the baseline that we had, and they're looking, tells you the group, the target group, which is adolescents aged 12 to 17, received one or more preventive healthcare visits in the past 12 months. So in 2016 to 2017 in this particular example. And so the baseline was 78.7%, which is pretty good, I think. And then the target was set to 82.6%. So that's again, little steps to get there, and then keep on going. The most recent data, however, is from 2020 to 2021. So it was 69.6%. So what factor do you think might have played a part in this particular objective getting worse? I will leave that up to you to answer. You can, and we don't have more recent data. They haven't been able to compile that yet. So we tend to run behind or very behind in the data in some of these objectives and categories. But it will provide you with data, the methodology, and evidence-based resources for that. So that is how you can look at, again, some of the situations that you all described. You can go back and find an actual objective and see, okay, insurance is an issue. So my grandmother, my mother, my spouse, my friend isn't the only one that has that issue. That is something that the country is dealing with. When we go back then and look at, let's see, so that was Healthy People 2030, and those are the social determinants of health. So I believe that we are good there. Let us look at, which we did. This is the next part of the lesson. So if you go to the bottom of the page, it will say next, and it just keeps taking you through the module. It's walking us through the week 2 module. And so again, this is sort of the same thing that we just did, just putting it in different wording. and looking at how specifically Healthy People 2030, which we just looked at, addresses the social determinants of health. So it gives you different examples of social determinants of health. And it tells us that they contribute to wide health disparities and inequities. So people who don't have access to grocery stores with healthy foods are less likely to have good nutrition, which raises their risk of health conditions like heart disease, diabetes, and obesity. So that is where the health and the social justice piece come together. Could even lower life expectancy relative to people who do have access to healthy foods. So what our students in the nursing program will do is they will do a community windshield survey for a specific zip code, and they will look at the different, there's actually like a checklist that they look at in the community at these different indicators of the social determinants of health. One of them being, are there grocery stores? Are they healthy? Are there any, is there some place that has organic food? How many fast food restaurants are there? Looking at things like that. How much does the food cost? What healthy choices? Is it maybe Blue Zones certified or not? And so that is a factor, and a disparity, and potentially an inequity as well. And so when you look at just promoting healthy choices, it says that's not going to eliminate these. Because you can say, well, they need to eat better, they need to eat lettuce, salads, they need to eat more protein, they need this, that, but that's all well and fine unless but if it's not available, that's a problem. And so what it's felt is that the public health organizations, people in the communities, education, housing, people need to come together to improve the conditions in people's environments. And so that's how Healthy People has stepped in to help with that. And so it just gives you more information about that. So let us move on to health models and community organizing. Excuse me. So we're going to focus on the models right now. And then as we go later into the summer semester in a week or two, we'll come back and look at the specific community organizing and assessment and SMART goals pieces of it. But the models, again, this goes to the link that was provided for you with the different types of models. And so there are individual approaches, because one of your objectives, this has to do with compare and contrast the individual approach and public health models that seek to explain health disparities. So the individual approach is basically just that, the individual person. They focus changing behaviors of individuals, like through teaching, through interventions, getting them to do things, doing things with them, while public health approaches aim to improve the health of populations through societal community type changes. They overlap, they can work well together, and to have a comprehensive, overarching, holistic approach to health, both are needed. So when you talk about the individual, things like maybe, like they give an example here of a smoking cessation program or providing nutritional advice or nutritious snacks, looking at the different theoretical frameworks. And so the hope is to empower, to advocate for individuals to make healthier choices and adopt positive health behaviors. So in that component, that's great. Like, I would love to be healthier. I would love to lose weight. I would love to exercise more, or all these different types of things. Do I have a means to do that is another question. So then that's where the public health approach comes in. And so that will address the social determinants of health and also the structural determinants of health, which can also be thought of, could potentially be barriers as well. And so what are different tobacco control policies? Are there taxes on tobacco? You're not allowed to smoke in places anymore. That's changed over the years. There's no cigarette ads on TV anymore. And those are all through political policy, campaign changes, things like that. And then you're going to they'll look at different theoretical models like the socio-ecological model, which is further in the lesson, which talks about how you get everybody kind of together to figure out a solution to the problem. And so that just continues to talk about that. So the next part of the lesson goes into the different public health approach models. So the health belief model is here, deals with the individual perceptions, looking mostly at, is there a threat? What is the perceived seriousness? So this is me as an individual. So, for example, let's take being overweight. I'll just use that as an example. So how do I perceive the seriousness of myself being overweight, right? How severe are the consequences if I don't change the way I eat, the way I exercise, taking my medications, watching my blood pressure, those types of things, checking my blood sugars, those types of things. What's the perceived seriousness, me personally? And then the susceptibility, the likelihood or risk factor of developing poor health behaviors based on genetics, personality, negative consequences of condition, how harmful it truly is. So probably don't have, I don't know, great genes in this respect in terms of holding on to fat, but the seriousness, pretty serious. So then we're like, okay, does the person understand how serious smoking is, being overweight is, using drugs and alcohol are, things like that? Okay, they do. They see that, hey, if I don't change, things might not be so great. So then we have to look at, the person has to look at, okay, can I change that behavior? I want to change that behavior, but what's standing in my way? What's standing in my way? What happens if I can change? What are the benefits? That can I do this on my own? What are some things that are really going to make me take action? So is there a cost? What kind of barriers are that? Well, maybe I live someplace that doesn't have healthy food, or I don't have transportation to get to someplace that has healthy food. But if I stop eating unhealthy food, that'll be amazing. Or if I have a new habit like intermittent fasting or something, that I can do. And I can achieve this. I have to believe that I can achieve this. And maybe there's usually got to be some kind of cue to action. There has to be something. Sometimes it's an event, it's a person. For me, it's wanting to be around for my granddaughter. And like I've got to do something about this, right? And so I think who was it? I can't remember who it was. I want to say it was Jewel. I'm so sorry. I can't remember. Has had a weight loss journey, and I have as well. And so the change occurs, and it's promoting positive habits, and I'm seeing good outcomes. And so I keep doing what I'm doing, and I keep losing weight, and so I feel better, and I can play with and hang out with my granddaughter. That's the health belief model. That's an individual model, as an example. And so oftentimes, how do you use that when providing education? I will ask someone, what's important to them? What's important to you? What happens if your blood pressure gets so high and you have a stroke? How would that affect this thing that's really important to you? And what kind of changes do you envision being able to make? There's another model called the trans-theoretical model that talks about pre-contemplation. So thinking about something ahead of time and then really, increasing my thoughts about it, my contemplating. Okay, yep, I thought about it. I really kind of want to do this. I'm going to prepare how to do it, and I'm going to take action. I've taken action. It's working. How do I maintain it? And then did I reach my goal? Do I terminate? Am I able to terminate whatever it is I'm doing because I'm good now? Or do I perhaps fall off the wagon and have a relapse and have to get back into it again? So that's another way of thinking about behavior, and generally speaking about an individual behavior. So I'm pre-contemplating, I'm kind of thinking about it before I get in the cycle. Okay, this, and they're all related. So I'm building an awareness, overweight, I need to make a change, not quite ready. A lot of times you'll hear people say, well, they're not ready to stop smoking, or they're not ready to lose weight yet. But once they are, then they'll go ahead and do it. And so then I'm like, okay, I need to do this. What am I going to do? What do I need to do? How can I do this? I'm contemplating it. If I'm thinking about it now, I'm thinking about the positives, the pros, the things, and so I'm more likely to move forward. So then I come up with a plan, I commit to my plan, I take action, I work my plan. If it, if I end up having a piece of cake today, okay, then I revise my plan a little bit. I don't go to my friend that bakes the best cakes in the world, something like that. And then I've maintained and I integrate the changes into my lifestyle. So those are individual ones. You can kind of see how they could help you when providing health education to individuals or small groups of people. The socio-ecological model or ecological model is a social one. So this is more of a community public policy type of model. So that starts with the individual, the person. So we started with the individual, and then it's going to expand from the individual to the interpersonal. So intrapersonal is with me, interpersonal is between people, moving up to the organization, and then a community, and then being able to hopefully develop and or change public policy. So you can see where that goes beyond just the individual. It's going into once the individual has the idea, then they're going to spread it around to friends. You're going to take it to an organizational level, get people to help support them, and then and then the organizations can get together and help each other, and then help to change public policy. And so you have some resources here for that. And then there's also the social norms approach. Excuse me. A lot of times you hear about scare tactics. It says the social norms approach does not use scare tactics. But it does kind of have an undertone of how the population should behave. That would be norms. You should do this way. And it is participatory and includes that also includes members of the target population who we're looking at to provide the education. And so this is a little graphic that talks about that in terms of underlying problems. This one is talking about alcohol. So there's an underlying problem in terms of personal hazardous drinking pattern, right? And so there's a misperception of normative behavior in the person that drinks. It looks like they're using young adults perhaps in this example, because then it says campus-wide social norms marketing campaign. That's an intervention strategy. So the problem is that there are personal hazardous drinking patterns. Students are drinking and bad things are happening. So they're going to do an intervention strategy, which is a campus-wide social norms marketing campaign. And so the intervention, the goal is to correct the misperception of the descriptive or the norms, that it is not the norm to go to fraternities and sorority parties, every Saturday and drink till you pass out. That's not the norm. And then the anticipated outcome would be an increased use of protective behavior. So through other people, people that are doing the educating or watching out for each other, having it become the norm that you don't drink every Saturday night to excess and pass out. That is the norm, not passing out. That's not the norm. And so the desired impact is then met. There's harm reduction, decreases alcohol-related adverse consequences. So then people aren't going to be driving drunk and getting in accidents or other bad, having bad things happen to either themselves or the people around them. So that is an example of that. Okay, and then let's go next to, so this will help in the in those policies. Again, that will help in terms of when we're trying to educate people or to have change happen in the community. These are some theories that we can work with to help with our strategies. And then the third part of the lesson this week talks about structural determinants of health. You have some different pictures and graphics here talking about that, some different links that talk about structural determinants of health. That's an article. Did not want that one. It's an article you can read on that. So you saw this graphic earlier, right? These are the social determinants, those 5 social determinants of health. And then structural determinants can be, for example, governing processes, government. That's why we look at the government. Economic and social policies could potentially be racism, discrimination, bias, those things that are structural outside of the individual. These are societal kind of type things. And then when you have those, I guess what you would call upstream, those overarching things like a policy, and then that comes into contact with a social determinant of health, then the outcome that you get could be poverty, could be wealth. How does it affect education, employment, transportation, all those things? They work together to form the outcome. So if we look at specific definitions, the World Health Organization defines, and we're going to talk about structural determinants of health as SDH and social determinants of health as SDOH. That's how we're going to identify those two. And so governance, economic policy, social norms have influences on how power and resources are distributed, and which can affect people's living and working conditions and therefore their health. And so structural determinants of health, conditions in which people are born, grow, live, work, age, shaped by distribution of money, power, resources at the global, national, and local levels. So it does include local, could include local levels. They're outside of the individual control and significantly impact the health and well-being. When we look at the social determinants of health, they can be outside of the individual control, but with them, there can be an overlap, and sometimes individual control can help to move them forward. And often in structural determinants of health, there is a hierarchy, a power hierarchy involved. So looking at economic and social policies, that has wide-ranging influence and over the income, over employment, housing, education, governance, government, and political systems. The country's in turmoil right now. We're going to stay out of that for right now, but there's so many different things happening right now. And we can get into those if you would like to address those. There's an assignment, I believe it's next week, looking at current public health issues. And so that would be a good place if you're feeling strongly about things that are happening right now to address that, and we can work through those. Also looking at the social and cultural norms. And then how do those then impact health? So there can be, for example, an unequal distribution of resources that leads to health disparities. Socioeconomic position, their education, income, how does that position affect their health and well-being? Yours versus mine versus someone else's, depending on all those factors. They're also what are considered, what they might consider intermediary determinants, like housing, food, stress, social support, some things like that. And why is it important to address the structural determinants of health? Because we need to help to reduce the health inequities. We need to take action across multiple sectors. We're looking at the social determinants, right? So health, education, housing, all those parts of the social determinants. And then there's a couple graphics here, infographics to look at. So here's your structural barriers to health here, looking at institutional inequities in terms of like public health, banks, budget decisions, those types of things, and how the social inequities, so income, class, race, ethnicity, orientation, immigration status, those things connect with those institutional inequities, leading then to these living condition inequities. So those are things that happen. They overlap and intertwine together. And then what happens is then that may lead to examples of behaviors that may contribute to risk. So for food choices, low physical activity, choice of careers, educational attainment, access, which again is a big theme for you all. And then when you connect all those things together, what happens if you have those behaviors, then you are more likely to have diabetes, heart disease, hypertension, those types of things. And so all of those factors lead to health and well-being, morbidity and mortality. So morbidity is being ill, mortality is dying, decreased life expectancy, and decreased quality of life. So those are how those all come together. And then when you look at the policy and law, what are things that can be done to help with these barriers? So hopefully partnerships and advocacy, which is something that we're going to be looking at, advocacy, civic engagement, community organizations, right? We can put some policies, we can maybe enact some laws, health literacy, getting information out to people, making sure they understand it, and then quality and accessibility of healthcare as well. Just another infographic in case you like that one better. More information to define social versus structural determinants of health, different examples in real life that you can look at as well. These are more examples in healthcare of how the structural and social determinants, similar to what we saw in that first graphic, will actually come together for a person who has asthma. And then there are a couple of infographics here in terms of people who have epilepsy. And then this one particular source did talk about federal level innovations. So Medicare Advantage plans, which are supposed to thought to help with things that aren't covered with Medicare. They worked through Social Determinants of Health Act to help, for example, homeless, those without housing. And then they've also got like a post-acute care transformation act to conduct research on the social risk in Medicare's value-based payment programs, because depending on, for example, if you're a long-term care facility who has Medicare, who takes Medicare, and Medicare is the reimbursement source, you don't get paid all that. Like those payments are so far behind, and you're trying to run a business, which is what a lot of this will come down to. And so how can we make it better? How can we get people in long-term care facilities, for example, better care? How can they be able to stay longer, get better quality of care? Then there's also the idea of how education can affect health incomes, health literacy, access to education, different contextual factors. And then I think it's a half-hour video in terms of advancing health equity, how to address structural determinants of health. So I thought that was a pretty interesting one. And that's basically your lesson on structural determinants. We reviewed the accomplishments. Oh, these are all the readings. Let's go back to the modules. And it's going to go through the Medicare, Medicaid readings. So we got through those. Let's look at what you need to work on this week. So let's start on the reflection on objectives using videos. So the video is going to be unnatural causes. And so this, it's kind of a long page because there's like 7 different sections to this documentary. But it's a PBS, Public Broadcasting System documentary. I believe from 2014, around that time, but much of it is still pertinent today. And so what you need to do is you need to look at the video descriptions that are provided. Again, I believe there's 7 of them. And then you're going to choose one to actually watch. I believe the first one is an hour. The other 6 are about half an hour to watch. And then you're going to write a reflection to answer the prompts that are here. And the answers should relate to the video that you watched. And you want to provide examples from the video in your answers. So we are relating, again, the weekly objectives to this. And so I believe there's 10 questions total. I believe it's worth 10, the assignment's worth 10 points. And so these are the questions that you need to answer for the video that you choose. So you would answer those particular questions, talking about income and wealth disparities. You would answer these 3 questions related to structural inequities and race and gender. and then looking at education. And then when we look at the actual course outcome, which public health model might explain the disparities and which model seems more effective for understanding the story. So these all relate to the video that you are going to watch. The answers should be more than a couple sentences. I like 5 sentences, I think is a good goal to have. If you have questions, please reach out. I'm happy to have a discussion with you about the questions in the video that you watched. This tells you about the whole Unnatural Causes documentary movement. And then these are the episodes. In Sickness and Wealth, When the Bow Breaks, Becoming American, Bad Sugar, Place Matters, Collateral Damage, and Not Just a Paycheck. Gives you a little mini summary there. And then you actually have the videos beneath that. So you just choose if you wanted to do Bad Sugar, it's about diabetes, click on that. You can watch that. When you go to the YouTube site, there are transcripts, written transcripts available there for those of you that like the transcripts as well. So you watch the video, you keep these questions up here in mind while you are watching the video, then you write your reflection. And I believe, I know there's a rubric somewhere. I will find the rubric for you because it should be there. And what else? So that one I think is kind of fun. The videos are pretty good. And then let's do the case study analysis, local structural barrier. So there are 3 case studies that are provided for you. You're going to read through the 3 case studies, and then you're going to choose one to analyze and respond to the prompts in at least 300, 400 words. And you want to, when you are writing your responses, bring in content, concepts, something from the lesson. So I just reviewed those 3 lessons with you. So bring information from those lessons to the case study that you choose to analyze. You can do outside research or other credible sources. You can add those into your analysis. So you read all 3, choose one. So one's on housing insecurity, one's on transportation, and one's has to do with governmental barriers. And so these are the overall prompts for when you are analyzing them. However, there are specific prompts for each case study. So what you will do is, for example, if we do the last bus, transit access and preventive care. Let's look at the case study. So it gives you the scenario. It's a short little scenario. And then these are the specific questions based on those 5 that have to do with this particular case study. So what structural factors are involved? How are they contributing to the poor outcome? How does transit access function as a social determinant of health? Where does that fall in those 5 categories? And does that in some way reflect systemic or structural inequity? And in what way? So students will say, well, it does this and this and this. Okay, in what way does it do this, this, and this? Why does it do that? And as a result of that, what happens? Those are ways to keep, when I give feedback for go deeper, be more in depth, keep asking why, who, what, why, when, how. And then is there any potential system level change? When you think about a system level change, think about not having barriers, right? If there was something that you could do, what would you implement, right? And what would that look like? And then take the case study and relate it to Salinas or wherever you live and answer those questions. Is there a similar problem in our community? And who's most affected by that issue? Elderly, low income, who's affected? And then are there any local organizations or policy or efforts in place or needed to address the problem? So that was an example of that. And then let's go back. So that's that assignment. There's the rubric. I must not have added a rubric for the other one, so I will make sure that I add a rubric. I apologize. And then we have the discussion, how structural and or governmental factors shape health outcomes. You can This is that little subscribe button that you can click on so that you get notifications when somebody's posted. This will, I thought I had a rubric that should say show rubric. Thought I had a rubric. I will double check and make sure. I'm so sorry. Your initial post is due by Thursday, the 19th. We're looking at the structural determinant, so policy, systems, institutions. And so what you want to do is choose a structural or governmental factor from this list below. So it can be public transportation, school funding, food programs, housing, access to health, immigration enforcement, environmental regulation, Medicaid expansion, or insurance policies. Those are examples. If you would like to choose something different, that's fine. I would message me to make sure that it's going to fit the criteria. And then you can proceed if that works out. And then in the post, what is the policy or system that's in place? What is the transportation policy or system where you are? What is the funding or the food programs? What are those look like? What's involved with those? And how does it affect access to care or health outcomes for a specific population? So, and what structural change might improve this particular system? So if we take public transportation, because that was Tariq's case study, what is the policy or system? So is there a transportation policy? Are there buses? Are there cabs? Is there Uber? Like, what are the transportation policies? Like, does everybody have to pay to use the bus? Are there discount cards or the things that you can get? Do the buses only run certain places? Like, it's hard to get, like, where's the nearest bus stop? Where is that? Where's the bus stop near your place of work? How far do you have to walk to the bus stop and from the bus stop to your place of work, or wherever it is you're going? And how does that affect access to care or health outcomes for specific populations? So if I have to go a long way to get to the bus stop and I am wheelchair bound, that could be a problem. And then is there any type of structural change that might improve the system? Is there something at that structural level, a policy, a system, something that could help, that you would envision could help with that situation? So also include, please, one of the following: some community example, a current event or research article to substantiate what you're putting in your post, and an example from the weekly lecture or reading, something like that. I did not put how many words, but I would hope for at least 1 or 2 paragraphs to address each of the questions. And then you can begin responding on Thursday. The hope is that most everybody will have posted so that everybody will have a good number of peer responses. And so, go beyond I agree or good post. Choose at least one of the following ways to engage with your classmates, right? So expand with your own example, connect, add in some information that you found in the course that speaks to what they talked about. Ask a thoughtful or clarifying question. Compare, explore connections, something like that. The other, I did put how many words? I thought I did. And so here's the grading criteria. The initial post needs to be 250 to 300 words, right, by Thursday at midnight. Then the peer replies are due on Sunday. Complete posting or reply to 2 peers using one of these strategies up here. Write at least 75 to 100 words for each peer response. Again, due Sunday. You can start replying on the 19th. And then if, for example, a classmate uses number 3, ask a thoughtful or clarifying question. Please return to the discussion on a fairly regular basis or bookmark it so you know when somebody's replied, so that you can check to see if another student has asked you a question, because the expectation is that you will answer that question, right? You're just not write your post, write your response, and you're done. You need to come, it's a discussion. So you need to come back and see if somebody's asked you a question, or if you've asked a question, did someone answer your question? And so that is the expectation. Again, I thought I had a rubric. I'll make sure the rubric is there. Go in detail as much as you can. And we covered that, and we covered that. Let me go back to home because I think I've spent about enough time doing this. It's just a lot of information. It also overlaps with week 1. And I will continue to try and do a midweek check-in, maybe a weekend check-in as well. My hope is to continue on Mondays to provide you with the walkthrough for the week. And you will get these, the overview pages will be up on Sundays. And I believe that's everything I had. So I will stop sharing and leave my student view. And I encourage you to reach out with questions in the chat or private message me. I would encourage you to spend as much time as you can in the course. The expectation is actually 3 to 6 hours a week because we're covering between 1 and 2 weeks of material each week in the summer that we are here. And the more that you are doing your own research and looking at what's provided in the course, hopefully the better able you will be to understand how you can make a difference, how you can identify barriers, inequities, and then be able to create ways to help. What else can I think of? If you have questions on your journal, reach out in the chat. Let me know. That is due. The week 1 journal is due on Wednesday. So again, just leave a link, a website URL, or in the comments. That would be great. And have a great rest of your week. Thank you so much.